Guys, and welcome back to the Finish Line School. And all right. Now they want to teach me how to go about, you know, doing the live with new features on. Uh, Evening, sir. How are you? Osti sir has just joined in. Rudra has just joined in, and I'm going to get Dr. Prabuddh Sen, our smile surgeon, online. Okay, Ayush has joined in. Wow, सबके सब आ गए. क्या बात है? Let's just get. It's been sent. Yeah, let's see. Surya, how are you? So I just sent him the invite for him to join in. And the meanwhile, I'll be coming up with more academic and educational content as I'm bringing it up every week. So there are going to be like around 2 live sessions per week. One of which is going to be definitely a practice management session, and we are also going to have more sessions on subjects that touch dentistry as such in a social context, right? Where do we stand as dental surgeons when it comes to society, considering that I think we are all going through a very challenging time as far as dentistry is concerned. And without any further delay, I'm accepting. All right, I've invited Dr. Prabuddh Sen, our smile surgeon, to join in tonight. And all right, isn't able to join. Why is he not able to join? All right, let's try this again. Okay. Oh yes, he's coming.
Good evening. Good
Hi, good
evening.
evening,
Good
good
evening. Am
evening.
I am I am I audible? Am
Oh
I
yes,
clear?
absolutely clear, absolutely clear,
All
absolutely
right.
clear. In
Excellent.
fact, I have
Excellent.
to drop the volume down now. I just had it in my side there.
All right. Sorry about that, buddy.
और बताइए
I
क्या हाल है भाई, क्या हाल है टैंगो, कैसे हो? So I'm
कुछ
going to
नहीं.
keep this भाई ये एकदम वैसा भी नहीं होने वाला कि एकदम ही फॉर्मल टाइप का टॉक होने वाला है. So I'm going to keep it going
Yeah,
with
yeah,
the
I
flow,
know. I
right?
know. I know. I know. I get
Absolutely.
it. Totally.
So if you've been
Totally.
through my previous practice management sessions, we generally talk about, the emotional part of the practice, the practical part of the practice, and the financial part of the practice.
Yeah.
And
Yeah.
one thing that I keep clear is that I do not really discuss much of the subject in these sessions because that's just
Yeah.
absolutely
Of
off the
course.
subject.
Everybody
We
knows the subject.
Yeah, everybody knows the subject. So reiterating once again, I think all of you and most of you have already seen that one subject that we do not have in our curriculum is that of practice management, whereas it
Yeah.
exists in the curriculum of BDS. And if you do a BDS from any other country, for example, even England, or even if you try one of these better
Yeah. They
African
do.
nations, even African nations, they have a practice management exam which is absolutely mandatory. You have to clear it. Only then do you get your degree. Otherwise, you sit at home. Right? That's how they have it because they do
Very
not
true.
train you to sell. Now, the same thing is coming up with most other courses, that the main defect in the education system lies that they generally don't teach you how to sell yourself.
Yes.
They give you
Manit and
that's
I
what.
have had these conversations at length over the last several years.
Absolutely, absolutely. So
Very
that's about it.
enlightening.
Yeah, so that's why I came up with the idea of practice management session, so that we can bring about like-minded people. If not like-minded, at least we can bring about people who have ideas to offer on how to stabilize and run your private practice, which is not taught anywhere, so that we can eventually come up with some sort of a, what do you say, some sort of an
we
algorithm
can, we can we
of
can we
sorts.
can learn from each other. It's a continuously learning process because everything is changing. It's constantly changing. How you market, that is changing. So what was holding true maybe a few months ago is not going to apply right now. So you have to keep
Right
up with
now.
the times. And I think your initiative is excellent in bringing together people, because as long as we have new ideas, we just keep on improving
Absolutely.
upon what we have. So
ये तो बात
very
पक्की है.
grateful for this. Yeah.
Thank you, Tango. Thanks a lot. And why am I calling him Tango? Was that's the tag that we've always given to him. Right. I was just telling them that why am I calling you Tango again and again? His name is Dr. Prabuddh Sen, and he's a smile
Yeah.
surgeon, and
Yeah.
he's practicing in Faridabad right now. So,
Yeah.
yep, that's about it. So, starting off with the main question, just a brief introduction of yourself and how did you come about into dentistry and how did you enter into oral and maxillofacial surgery?
So dentistry, it was not by default, and bus college मिल गया तो मिल गया. Everybody, most of us, we enter with the thought of getting a medical seat, and this is what we get if you don't qualify for a medical seat. But happy to be there. Oral and maxillofacial surgery was always very interesting for me, and fortunately, I cleared the exams and got my desired seat. And then, of course, then the training happened. Training was quite difficult, and you have to, like, if you're truly interested in maxillofacial surgery, then it all begins in your first year PG itself. You have to show keen interest. You have to step outside your own institution. You have to go to a variety of places to learn. Like, I had to travel 30 kilometers daily, after college hours, to find out if there is a good case happening somewhere else in my town, and then assist them, learn from them. So those kind of things happened. Then, yeah, subsequently I got a fellowship from Apollo Hospitals, and I was briefly a senior lecturer. I joined government service. Now recently I started my private practice. So there's nothing like private practice. I'll be very honest. That is the best thing that any dentist, dental surgeon, any postgraduate dental surgeon can do right now is private practice, because there truly the sky is the limit. That is what I
Truly
would
the
like to
sky is
say.
the limit. Absolutely. So, coming down to the second question would be that, what exactly you experimented so much all throughout? Was it probably the experience that you gained through all your experience of working with or under somebody that you finally decided to, have your own wings and fly out and, find a
Yeah.
niche,
So
carve a niche for yourself?
yeah, I to be honest, yeah, I sort of did get tired of working under somebody. That there is a limit to which even when you have to report to someone, where you are responsibly reporting to somebody else. So
Okay.
that poses certain restrictions in the way you want to operate your cases. And it is not always going to be the case that the person who is on top of you has more knowledge, or is more qualified, or is uh, somewhat better than you in what you do. So it is not always the case. Sometimes this happens. So I realized that full autonomy, like, if you are truly interested, अगर आराम की जिंदगी नहीं चाहिए, or if you really want to, like, work in your own sector and get somewhere, so you have to go on your own. And I believe most of the good practitioners that I've seen, they have very early in life they went on there. So that
Yep.
is what I
Yep.
understood.
Absolutely.
Yeah, so I have experience of all facets of dental surgery and maxillofacial surgery. I've worked as a cancer surgeon. I've worked as a cleft surgeon. I've worked as a trauma surgeon. I've worked as a craniofacial surgeon, and now I'm working as an aesthetic surgeon. So I have tried every field of dentistry, every field of maxillofacial surgery, and every form of practice that is out there. Consultancy बोलो, corporate hospital बोलो, government service बोलो, सब करके देखा है. And
Okay.
now I feel that this is really the thing for me.
It's really the thing for you. Absolutely. So, moving on. So, how about the location part of the thing? Whenever we go in for private practice, most people complain कि यार rent ही इतना ज़्यादा है कि मैं rent कैसे चुकाऊंगा? तो आधे लोगों को तो rent ही रोक देता है private practice शुरू
Yeah.
करने से. So, was that ever a deterrent for you initially that
Yes,
rent
yes, it
बहुत ज़्यादा
was. Yes, it was. So it absolutely was. In fact, starting my private practice was one of the scariest experiences ever. Because whenever you want to start an enterprise, see, when you're a practitioner, you're an entrepreneur. All right,
है? Yep.
you have all the qualities and properties of an entrepreneur. You are hiring people. All right, you are starting from scratch. You are running your own business. You are investing in your own business. So everything that an entrepreneur does, you are doing when you are a private practitioner. So naturally, the fears are there along with that. Rent is a really big deterrent for getting a lot of places. So you have to really, really hunt. Like, it took me before I left government service, it took me almost 2 months while I was planning to narrow it down as to which area I was going to practice, and what kind of a setup I would want, how much space can I afford. So you really need to do your finances. So while choosing a place, I would like to say there are two things that you have to always keep in mind. One is naturally your budget, how much you can shell out. And trust me when I say this, you can always shell out a little more than you think you can shell out. All right, that is always
Mm-hmm.
true. You can always do a little more than you think that you can. And
Yep.
secondly, before choosing a place, you need to identify with the people who are working in that, who are living in that area, the societies that are there. You have to socialize with some people. You have to speak to them. You have to understand their wants and requirements, and accordingly, you have to start your practice. So these two things are really important when you consider the location. So rent, of course, is there, but if you feel that the place is really going to benefit you, and thoda bahut stretch karke you can afford it, then you must go for it.
Absolutely. Wow, that's very well answered actually. Right, and I think you've almost nailed every point in that, right? The
I hope so.
next thing that I think a lot of viewers here would want to know is that, once the rent part is done, everything is done. Uh, some people always try to target a particular type of, client base. All right. For example, there's a clinic
Yes,
right here in Chandigarh. They are only treating foreigners. They are probably not dealing with any of the
yes,
Indian clients.
yes.
There are clinics here which have huge mass practice. 30-30 40-40 आदमी वहां बैठे रहते हैं
Yeah,
लाइन लगा के उनका पता नहीं 2-2 मिनट
very
में कुछ सीमेंट कोई मसाला ही बोलते हैं मसाला भर भर के काम खत्म कर देते हैं
true.
हाँ इवेंचुअली दे कम टू मी दैट्स व्हाई आई नो ऐसा चल चल रहा है ठीक है और
Yeah.
क्या बोलूं
Here, here.
ठीक है हाँ ऑलराइट तब मेरे को पता है ऐसा चल रहा है ये
Yeah,
दांत ऐसा निकाल दे देखो ये दांत तो पूरा निकाला आई कैन सी द रूट पीस इनसाइड ऑलरेडी जिसको वो निकालना फिर बाद में शुरू करते हैं दे स्टार्ट वर्किंग ऑन इट एक्सेट्रा
yeah.
ठीक है
I know.
कहते हैं जिस सारे दांत बाहर से निकाल लिया अब डेंचर बना दो आई कैन सी स्पिक्यूल्स ऑल ओवर I know where they've
Yeah.
come from, right? I already know. I can even name some of those places on their face. So, so what was your idea? Did you particularly start off with the idea of a particular client base, or did you think of making it
Yeah.
flexible for
See,
everybody?
you have to decide very early that what is supposedly your end goal. So naturally, your end goal is something you keep very close to your chest. For example, if your end goal is building a huge practice, so you will have to do every type of practice. You'll have to do mass practice. At the same time, you'll have to try and field patients who are a little bit of the higher class category. If you want to, go for something like I want to build a franchise, then again you have to try all the waters. You have to test out all the waters. And suppose you want a very niche kind of a client, like what I'm seeing these days, a lot of dentists they have shifted to aesthetics. Like general body aesthetics. They are transitioning into what I should say is basic dermatology, aesthetic dermatology, which is all right as long as they are doing non-invasive procedures. That's fine. So they are carving out that area. They know that this is what I want to get into. So you have to establish that a little early. Now, unfortunately, at any given stage, and I think we talked about this at length, हमें नहीं पता होता कि हमें क्या चाहिए,
क्या
right?
चाहिए हाँ
we
कभी
are
भी नहीं
we
पता
are
होता
not entirely, and I have had the privilege of working in a variety of situations. So yes, I had that advantage. So I figured out that okay, these are the proper things that I want. This is the kind of practice that I want. I had some seniors I could look up to, etc. Now if you don't have any of that, then you really need to do some soul search. You have to identify your strong points. What are you good at? Are you good at general dentistry? Or if you are an MDS graduate, are you really good at your subject? Like I know some extremely good people who practice exclusively their own branch of dentistry.
speciality
I
yeah
Yeah, I know orthodontists who only do orthodontists. I know periodontists who only do periodontology. So you have to carve out a niche for yourself, and that is how you proceed.
absolutely
So my practice is it's an amalgamation of everything. Like I do a lot of core surgical work. I have an OTVR right now in my OT, and I
all
also
right
have a dental. I also have a dental wing. I had around 500 square feet of space, and I got it for around 19,000 rupees was my rent. I'm giving you the figure so that anybody who's
wow
watching can gain something out of it.
some
I have
insight
nothing. Yeah, I so you can gain some insight. So I decided that since I have the space, and Faridabad is an upcoming town, it's in Delhi NCR, and it is
I think it's quite
just
established
as
already if you really
yeah,
trust me on
yeah,
that
it is nice. It is not like Gurgaon, but it is nice. It's very
yeah
it's quite advanced. So I realized that there are all types of people are here. There are people who are not educated but have a lot of money, and there are people who are very educated, have little money, and then there are people who are educated and have money. So you have
and have
all the three categories of people are there, and I wanted to target all of them. So I decided that for me, if I want to practice core aesthetic facial surgery, I need to build a client base based on dentistry.
Based on dentistry.
Because yeah, so if you want patients to come to you, you have to start with the basics, and that is how people show up. The first patient I had was, I think, when I started my practice, was a crown cementation.
Oh,
I Yeah, yeah, that was my very first case. I had just started my clinic. It was barely a day or two, and I was still wiping off the dust. And this lady came over, and it was a crown cementation, and I happily did it. And I realized ki this lady, okay, she's going to be my patient. I still text her, she still texts me back, and she's now coming to me for you. She got pregnant, and then she came to me for a checkup because she was pregnant. So that's how you build a clientele. So now I am trying to shift it towards facial aesthetics. So yeah, she's going to have a lot of pigmentations and those things after a delivery. So she's again going to come back to me. So you get your patients for specialty practice from your general practice.
from a
So
general
that is one
practice.
thing that I have learned. Yeah. So you need to
Okay.
be grounded at your general.
Wow. I think this is something that most people are unable to catch. Most people think that, probably, I don't know why that thinking is there, that, यहाँ से नहीं शुरू करना, especially after post graduation, you have that dopamine
Yeah,
sort of surge,
there
right?
are.
And that
That
adrenaline
is,
surge.
and I'll tell you, this is very common among surgeons. कि मैं dentistry नहीं करूँगा. Like मैं RCT नहीं करूँगा, and I hate to admit it, I was the same, right? There was a point of time I also did not want to do dental cases because I thought that अब मैं surgery में घुस चुका हूँ, specialty practice है, तो यही करना है जिंदगी. But once you learn, once you see that you're benefiting patients, and plus you get the money, you realize that nahi, it's worth the skill. It's a skill worth having. General practice is a skill worth having. You should have it.
Absolutely. Absolutely. Just give me 1 minute. I'll just shift this one to the other side. All right. I'm getting a bit of disturbance here. Just give me one
Yeah,
minute.
yeah,
All
sure,
right.
sure, sure, sure.
Just a
Take
minute.
your time.
You can switch off your camera meanwhile if you wish. Um, charging. So what I came up with was a very common problem that happens with your cell phone. The charge drops down right in the middle of an important conversation. So yeah,
Yes,
coming back to the topic,
Murphy's law.
Murphy's Law. Yeah. So, coming back to our main discussion, that is about practice management. One thing that that deters most people from entering into practice, that they have absolutely no know-how of, the type of permissions that you need, and the kind of financial part of it. How do you set up your financial thing? For example, I'll just give you a small example. That there was this one clinic I visited, which is probably the shabbiest clinic ever that I've seen. मतलब वहाँ मक्खियाँ भी थी, वहाँ स्टेरिलाइजेशन भी नहीं थी. Probably it was run by a quack. And he had that typical, जैसे shopkeepers नहीं रखते होते, the drawer in which he used to put the cash inside. So that was the lowest method I've seen. And the highest method I've seen is a clinic which only accepted UPI payments. It did not accept anything,
Yeah,
any kind of paper
I
money.
I have I will show you like if I take my camera there to my reception area, I have
You may
very
do it.
clearly written over there that we prefer online and UPI payments and card payments.
Already.
So that is good. It is a good practice to go digital and online, because I know the still a typical Indian mindset is that cash rakho, tax bachao, but long run mein it does not help. Absolutely does not help. So कितना भी आप कर लो, वो in the back of your head, like you have an additional task of managing cash. कितना cash manage करो? It is not worth the headache. Not worth the headache. Absolutely
Not worth the headache at all.
not worth the headache.
So considering the point of, you're already into a stage where you file your income tax returns, right? So
Yeah, yeah,
absolutely that record is also kept as far as the clinic is concerned. So that is one more aspect of it. Is there any other kind of taxation that you have to deal with in a clinic? I think, are we under the GST
Okay,
right now? No,
so yeah, so GST is something I learned very late. Like I thought that doctors are exempt from GST completely.
that's what I
All
suspect.
right.
Now you're telling me something new.
So it is not entirely true. So there are certain services and procedures which come under the ambit of GST. Now, if you are practicing them and the government doesn't know, I suppose that is fine. But if the government knows, at some point, somebody can come and raise a question that why are you not taking GST for this? So doctors are not supposed to take GST for certain things. So there are, for example, the aesthetic procedures. All right, a lot of aesthetic procedures, they do not come under they come under
Ambit of
the
GST.
GST Act. Yeah, they come under the ambit of GST. So this was told to me by a dermatologist who was practicing Botox and fillers. So he told me that he charges GST on Botox and fillers.
Oh no.
And yeah, so I never understood the how it is working. 18%. So he said, I like see you and I, when we are purchasing dental materials, we are paying GST, right?
Absolutely.
We are paying GST on the GIC, we are paying GST on the composite and everything. But the patient is not paying any GST to us. So technically, we are exempt for GST. The only advantage that we have is that we can charge whatever the hell we want to charge. So
Absolutely.
that is our advantage. Now, when it comes down to certain practices of cosmetic dentistry or cosmetology in particular, I'm not talking about plastic surgery. Plastic surgery is different. So when we talk about those things, we talk about things like Botox and fillers and peels and simple things that people are doing in the mouth, dental jewelry for instance. So
Once.
these things, they are supposed to be done under the ambit of the GST.
Yes.
So I have applied for a GST number. There is a little bit of paperwork involved because you have to make some proofs, etc. You have to have an UTM registration and all that. But आपको मिल जाता है. You get it done. And once you have it, it is good to have a GST number. It helps in the later on. People think that it will complicate stuff for you. It actually doesn't. It actually simplifies things. A lot of
Right.
things get simplified. Yeah.
With that. Plus, you avoid the hassle of somebody coming and checking on you and asking you that आपने अपना ठीक से रखा है process या नहीं रखा.
So this is something that before starting my practice, before anybody who starts their practice, they look for a list of approvals, like what
Correct.
are the things that we need, right? So I did the same thing, and there is a lot of stuff that the government says that you require, but eventually it turns out that you don't. For example, there is something known as the Clinical Establishments Act, right? So in Haryana, I actually went and spoke to the civil surgeon of my district. I went to him and I said that, for your Clinical Establishments Act, we are all supposed to be under the Clinical Establishments Act. So I told him that I have been trying to register for clinical establishments, but I'm not getting permission to register. So how am I supposed to practice in the state of Faridabad, in the district of Faridabad? So he told me that you do not come under the ambit of Clinical Establishments Act in this state. So in order to
Right.
practice in the state, it is also according to the number of beds you have. So I have a single bed practice. All right, I have 2 chairs, I have one OT and one bed. So I have a single bed practice. So hospitals which have over 24 or 30 beds, there is a regulation. They are supposed to come under the Clinical Establishment Act. You
Okay.
and I, if we have our council registration certificate, which is renewed, people forget to renew their council registration. So please renew
They
it.
do that all the
Always,
time. I think inspection
always,
के time पे सारे
always
line
renew
लगा
it.
लेते हैं.
Always renew it. DCI inspection is one thing, but कल को कोई litigation हुआ or something happens, then you will be labeled as an unregistered practitioner. So
Yes.
always be registered. Your paperwork has to be pristine. Then there is this one thing, updated council registration. Another thing is biomedical waste management. Biomedical waste, the smaller practices, I don't think they have to bother with it. Even if you have a single chair practice with a large volume, I suggest that you should get a biomedical waste approval. There are a lot of private companies which help you with the paperwork. It doesn't cost much, 6,000-7,000 rupees lagta hai, and they will help you. They will collect a lot of waste. So mine being a surgical clinic, I had to do it. So I have kept one documentation with a biomedical waste company, and especially in states like Haryana, it is very important. And आजकल UP is also getting into this. So UP and Haryana particularly is very serious. Biomedical
I
based
think
approval.
close to the NCR especially, I think it must be quite serious, right?
Yeah.
नोएडा
यहाँ
लगा
पे
लो
it's
आप,
quite serious.
फरीदाबाद लगा लो, गुड़गांव लगा लो,
हाँ.
इसमें तो सीरियस होता ही है, नो डाउट अबाउट इट.
क्योंकि सी हम लोग ऐसे बात कर रहे हैं तो क्वैक्स को कोई नहीं पूछेगा. If somebody has to hold an inspection for some purpose, they will come to your doorstep. They will not go to a quack because वहां से उन्हें कोई फायदा नहीं है. But finding faults in your practice will get them money. So
Absolutely.
you need to be prepared. You need to
That's
be
very
thoroughly
true.
prepared. Yeah.
By the way, have you experienced any incidents of quackery within? Okay, there is a lot of quackery in dentistry, but have you experienced any incidents of quackery within surgery as of now?
Oh, plenty, plenty. मतलब
पास्ट में
इतना
बढ़ रहा
बता. हाँ, plenty. I have had. So there is something known as a RMP. RMPs are rural medical practitioners, right?
है. All right.
So these guys they do a lot of abscess drainages. These guys they do a lot of suturing work, trauma work, and I'm okay. A lot of you may disagree with me over here, but I sometimes feel that these guys are required at some level. See, you and I are not going to go and repair somebody's lips or something for $50 or $100. You and I are not going to do that, and that guy can probably not afford any more than that either. So let them be. Quackery, जो भी है, there is everybody is shouting quackery हटाओ, quackery हटाओ. Honestly speaking, it should not affect you or I. We are not bothered. We have a standard of practice, and that is what we want to maintain. The quack can never have your skills. The quack can never have what you have. So you should not bother with what the quack is doing and what the quack is not doing. It is of absolutely no consequence to us. वो सुनने में लगता है that वो तो patients ले जा रहा है करके. But let me tell you, there are enough patients for everybody. If the number of dentists are increasing, then the number of patients are also increasing. So one does not have to have that negative point of view that there is a quack and he does extractions for $300 and he takes away all my patients. It doesn't work like that. If you are providing quality, yeah, we are both MDS degree holders. There are a lot of BDS degree holders with a lot of experience, a lot of great skill. There are diploma holders with great skill. You think a quack will be able to provide the same level of care as any of these guys, any of us? No. And at some point, a lot of patients will see that. And the one who has, like you told me, there is a, उसके खराब cases आए ना तेरे पास. जिसने बॉचअप किया वो eventually आया ना.
He was not a quack, he was a qualified guy, but उसके आए मेरे पास.
All right, whatever. मतलब it took a few months, maybe a year or so, but they turned around and they came ना. आया वो तुम्हारे पास. So that is what is going to happen. It's a game of patience. It's an absolute game of patience. Like you have to be patient. Like quack is irrelevant. A discussion about quacks is absolutely irrelevant. It doesn't affect us. We are way beyond what any of these fellows can do. Even I used to feel कि यार वो लोग क्या कर रहे हैं कि केस तो खराब हो रहा है. I have an example. Okay, I'll give you an example. Okay. So like in surgery, a lot of times there are these zygoma fractures, right? These arch fractures. Yes. There's a zygomatic arch here, so this gets fractured. So neurosurgeons, ENT surgeons, even plastic surgeons, when the arch is fractured, they don't bother. They let it go. All right. And now, as a slightly experienced oral surgeon, I have also decided to let it go. All right. But then there is somebody who's very overzealous. He will always open a huge flap, do it. See, patient has come to you with a problem and he says कि मेरे को ठीक करो. अगर without surgical intervention ठीक हो सकता है तो छोड़ दो, है ना? How much money can you make, like in one case? So that you have to gauge on your own. So this is where it comes down to like what type of practitioner you want to be. Do you want to like take a lot of money from one patient, or you want to take decent amount of money from a hell of a lot of patients? Like that is how you differentiate.
That's how you differentiate. Absolutely. I think I gave you a question. Nickelback, he says in his song that only a hero can save us.
Say a hero will save us. I love that track. I love that track.
That's from the first Spider-Man movie.
There's a left-handed guitarist also there. It was from Spider-Man 2002. The Tobey Maguire
Spider-Man movie. The first Spider-Man.
The first Spider-Man movie. Uska ending track.
So who's the hero in
So
your life?
okay, so my hero, like a lot of other people, is my dad. All right, like, and not just because he's my dad, because that man is genuinely brilliant. Yeah, my dad was an army officer, like multiple commendations, highly decorated. And after he retired, again, like he went into private, and everybody thought that an army officer will have a lot of difficulty in adjusting in a private environment, and he showed me that it can be done, and it can be done beautifully. Right now, my father, he's heading the largest cancer project in the country in Assam, and he has established 7 hospitals alone, and he's reporting directly to the home ministry also, and to
Wow.
the sorry yeah, to the home ministry and the Assam government. And he has done a great job. So, and he knows crisis management. Like every time I get into trouble, he's always said he, you know, चिंता मत करो, हो जाएगा, like be patient, हो जाए,
हो
like,
जाएगा.
and it gives you strength. So yeah, he's my hero, absolutely. I learned private practice from him.
Private
And
practice.
like for an army officer to tell me that कि बेटा देख ये तो धंधा है, and I
हाँ.
myself am surprised that my dad, from being Colonel Sajal Sain, MOD officer, and then he's telling me कि देख बेटा ये तो धंधा है, and you have to understand that this is how it is done. And I have seen him at work. I have seen him bring up hospitals, and that is how I learned from him. And like you said, like there is a clinic out there which does exclusively international patients. So I
Yeah.
asked my dad how it is done, and then he was the one who told me that this is how it works, and this is how you get facilitators. So finally, right now, I also have an international patient in the pipeline, and my practice is barely 2 months old. So
Yeah.
yeah, my dad's my hero. Like I am whatever I am because of
Wow. Wow. That's a brilliant answer there. And
it.
yeah, I think if I can do that, I would love to. Even the day this seed becomes a bit mature, the finish line seed becomes a bit mature, I would love to have Sir on the show as well.
Absolutely, absolutely. Yeah, he would love to be here too. He would absolutely love. Like,
In fact, on a panel discussion, well, since he's into cancer, if I do plan a panel discussion on cancer with at least
yeah,
three,
yeah,
four
yeah.
people around here, yes, that would definitely prefer.
Yeah, yeah, yeah. He will be more than happy to attend. He'll be more than happy to
Yeah. So, coming down to our almost our closing comments and closing questions, right? Uh, Seen so many shades until now. You've been through jobs. Again, the same type of question I'd asked previously. You've been through jobs. Now you're into practice. And the fact that you just mentioned that, it's a business, right? But बात ये होती है that हमारे ना माइंड में क्या डला हुआ है, ये तो एक सेवा है, right?
कभी नहीं, कभी नहीं. If anybody comes to you, any patient comes to you ऐसे करके, with हाथ जोड़ के कि आप तो भगवान है या आप ही हैं, you tell them, you
Hello.
stop this. I am a
Could
yeah,
you just repeat
am
that?
I
I think
audible?
that segment got stuck. Yeah, please repeat.
So when somebody says that the doctor is great, or doctor is God
भगवान
or
के बाद तो
anything in
डॉक्टर
front
ही
of
आता
you,
है. Yeah.
anybody who says this to you, you please go up to them and you correct them. See, I am not anything else. I am but a service provider. That is all. At the end of the day, at the beginning of the day also, you are a service provider. You provide a
True.
service and you charge money for it. It is very simple. You can maybe you do some charity, like we do some clefts for free, we've done some encephaloseals for free, but उसमें अपना भी फायदा होता है, because like you get a bit of practice, you get a bit of name. So that is all right, that is fine. But you don't have to do philanthropy in your daily patient work. Philanthropy अलग तरीके से करो, sponsor somebody's education, or like do some like build something for somebody, but don't treat patients for free. It is not going to help you or the patient. The patient will
Or
not
the
take the
patient.
treatment
That is
serious.
a very important point to understand.
Yeah, the patient is not going to respect the treatment or follow up with anything. It has happened with me. I have done trauma surgeries for free. It has failed multiple times, and I used to wonder कि जब patient पैसे देता है तो बढ़िया हो जाता है, पैसे नहीं देता तो fail हो जाता है. How is this happening? And again, it was my dad who told me that he's not taking it seriously. He's not going to value the treatment. And unless this you experience firsthand, nobody, मैं कितना भी बोल लूं आप इसको मानोगे नहीं इस बात, no matter how many times I say it. Like if somebody hasn't experienced this, they will still believe that ऐसा कैसे हो सकता है, like फ्री
ऐसा
में
कैसे
मिल
हो
रहा है
सकता है,
तो
सही
it
बात
will
है।
be so precious for the patient
आई
कि he
थिंक
got
उनको
treated.
को एक बार बस सरकारी
हाँ,
हॉस्पिटल जाके बैठ जाए और देखे वहां पे क्या सक्सेस फेलियर रेट चलता है, वो अपने आप समझ
नहीं,
जाएंगे क्या सीन है। हाँ।
उनको आप समझा ही नहीं सकते. You can there is a class of patients who cannot be taught or dealt with. Okay, for example, I'm running a lot of ads on social media right now, so I get
Yeah.
about 10-15 calls every day, and more every call. So I have made a filter for my calls. Like when a filter comes, sorry, when a call comes, one of my filters is ki what is the first question they ask. All right.
Okay.
If they ask, for example, I had a ad running for facial asymmetries. All right, so I got a lot of queries, like somebody had TMJ ankylosis, somebody had some kind of a lesion. So I have a filter. So एक होता है कि पहला क्वेश्चन पूछा कि सर आप क्या ये ट्रीटमेंट करते हैं. So that's a very good question. Like he's inquiring whether I operate such cases or not. Yes, I do those treatments. Now there are certain patients who will first ask कि something like cosmetic procedure का price क्या है, या फिर aligners का price क्या. That is the very first, like there is no hello, good morning, nothing. That is the very first question they ask. Like we all do, हम लोग सबका एक tendency होता है कि we want to find out how much something costs. But
Cost.
90% of the time we don't really invest in that. Like अपन मॉल में गए, पता कर लिया जूते कितने के, बट क्या हमने खरीदे. So
नहीं।
these patients are window shoppers. So that is my filter.
That is it.
So you feel, yeah, that is my filter, that these patients are not worth investing any time in. If they need your service, eventually they will come to you. It's a game of
Eventually they'll come.
patience.
It's a game of
Yeah.
patience.
But at present, you focus on the patients who want to get better, whose primary motivation is not to save money, but primary motivation is to treat themselves.
Treat themselves.
So that is how it works. So you need to have a filter. I had a handicapped guy. He's a
Always.
patient of oral cancer, and he called me up and he said, "Ki, sir, I saw your ad and this and this. I had oral cancer." He gave me his entire history, and only in the end he asked me. He said, Ki, "I am handicapped and everything. How much are you going to charge?" So I said, "Sir, you come to my clinic. I have a wheelchair now. So I said, we have a wheelchair access and everything for you. You come to our clinic. Let me see you. We will discuss what we can do. Whatever we can do, we will make comfortable for you." And so he's booked an appointment. So he wants to
Awesome.
treat himself, and he's the guy I want to give him a discount. I want to treat him nicely, and I want him to save money on this treatment. So I'll do the best possible job I can at the least cost I can. And वहीं पे जो patient हमें बेवकूफ बनाने की कोशिश करता है, I feel like I want to charge them extra. So you have to filter out the kind of patients you are treating. The Hippocratic oath makes no sense in the present age.
Absolutely.
It doesn't.
It doesn't make sense.
Absolutely.
वैसे भी तो चरक को कोच के साथ चेंज ही हो चुका है।
वो भी
Right
change
away.
कर दिया. Now
Right
NMC
away.
has come up with the physician's oath. That is the
The
third
physician
one.
though.
हाँ,
Yes.
the physician's oath. Now they have changed it to this because किसी ने बोला कि चरक हम नहीं सुनेंगे, ये religious हो, and some nonsense happened. So now they have shifted to. So these things are just happening. It's nonsense. Absolute nonsense.
Absolutely. So as we come to a close on the session, any closing comments, any kind of anything else that you'd like to say, any kind of advice
Uh,
that you'd like to give to us, or
I'll tell
and
you
every
like
all
I'll
the
tell you
guests who
take.
joined in tonight.
Okay, this is very cliche, but like I also used to think कि क्या बोल रहे हैं लोग, but you have to take a lot of risks. ठीक है, like when I left government service and I joined, I didn't have, I had some savings, and I wanted to start big. I did not want to start a simple single chair practice just for survival. So I thought, okay, I'm gonna go big. So I went to a couple of banks. I gave them my project report. I spent a lot of time on my project report. Like I had to draft projections. I spoke to chartered accountants. I spoke to business owners, entrepreneurs. I had help from some NGOs, and that is how I got a loan. And this is the biggest risk I've taken. I have a huge loan, but now I'm confident that I can pay it back. So you have to take risks. I was trying out some new treatment modalities, so I tried them on myself. Some of you might have noticed I have a small wound over here. So I wanted to try this new laser protocol, and I tried it on myself. I had a small lesion there, and I treated it. I healed it. So like you have to take risks. You have to experiment. You have to do
Calculated
all
ones,
sorts
of
of crazy
course.
things. Yeah, I've obviously calculated one. I'm not going to cut myself open. That's not what I mean. What I'm saying is that you have to do sometimes stupid things to get to know about things. जब तक एक्सपेरिमेंट नहीं करोगे तब तक पता नहीं चलेगा. So you have to take risks. Take risks.
So, absolutely.
मिल जाएगा टाइम. कुछ ना something or the other good will happen.
Other will work.
If your intentions are good, something good will happen.
Something
Have faith and take risks.
have faith and take risks. So that's the that's the take home message from today's session
Yeah, that's the
on the
message.
Finish Line School. And are there any questions from the audience, or would anyone like to come in live? No, that's what I do at the end of the show. If anybody wants to come in live, ask something. We've had wonderful discussion. If you've seen the last video of the Finish Line School, we had a wonderful discussion with Dr. Suryodaya Singh on the prevalence and the existence of oral cancer and different modalities that are available for its treatment. He's
Yeah,
he's currently practicing as an
we learned about
onco-surgeon
oral
in
cancer.
Chandigarh. Yeah, he's
Yeah,
currently practicing as an onco-surgeon in Chandigarh and Tri-City area. We call it the Tri-City, Chandigarh, Panchkula, Mohali. That's the area we live in. And
yeah.
he's doing a wonderful job there. So would anyone like to join in? Anybody at all? Or anybody has any kind of
Yeah,
questions that you'd like to
absolutely
put
open for
to
questions.
Dr. Prabuddh Sen? Yep, let's just see. Well, I think we have had such a good session. We've almost answered everything. Right, we've dealt with a lot. I do not think that
Acha.
I'll just scroll through and see if there are any questions. Okay, Mohit Das, thank you for the appreciation there.
Thanks, Mohit. It's good to hear from you
Yeah,
after so many years.
yes.
Lovely.
And excellent comments
Yeah,
coming in. Dr.
Rudra says
Chandramohan,
uphold.
your
Uphold
skills
your
is while
skills
charging.
charging.
Very
Very
well
true.
said.
Very true.
Very true.
Very true.
Very true. Very true. I think one hindrance that we have is I don't call it a hindrance. मैं सबको कहता हूँ कि यार अगर हम आज यहाँ पहुंचे हैं ना तो इसके अंदर would like to see Prabuddh setup. Suryodaya would like to see your setup, Prabuddh. Could you
Acha. Okay.
please, if
Okay. It's
it's
a little
possible, right?
shabby. Yeah. It's a little shabby. So I'll just show it to you. Hold on.
Dr. Albert Goldring has also joined in.
Um, how do I? Okay.
Just
Yeah.
all right.
So I have a small setup. Like this is my reception area, and this is the main road. Like I was fortunate enough to
Thank
get
you.
a nice location, and I have a very small reception. Like only a couple of people can sit here, but I have a waiting area in my corridor, so I have kept it over here. So I have one OT I have, which is a convertible OT chair. This can be converted into a derma chair as well as a operating table. It's a 4-motor chair. I have all my instrumentations and everything. I have a few machines here and there. Uh, I really like this. This was Dr. Rudra recommended this. This is an excellent laser. It's a class 4 laser, very, very useful.
All right.
And here I have, today actually I had a large implant case. So thoda sa sab kuch, everything is in shambles. So I really got tired. I didn't have time to set up. So yeah, this is like chair 1, and this is chair 2. Plant setup. I have WNHSI 1023 physio, and I have also kept a intraoral welder for cortical implantology, and it has come in really, really useful. So yeah, you have to invest in your practice. I have a small storage space over here, which I'm planning that I'll keep my OPG machine over there, and then baki to kuch nahi. I have a few cupboards. I have a washroom, and that's about it. It's a small, humble practice for now, and hopefully it is going to get somewhere in the next few years.
It's going to go places, Tango. This is going to go places. And I'm very confident, just as you've been putting effort since Manipal, Army Dental College, the job you've done, and everywhere else, I think I really wish that you go places, you take off, and just you got your wings now. You just have to fly. You just got to fly,
Thank you,
right?
brother. I think like since we have all grown together actually in the last 12 to since 15 years, I think almost. So I think we are all developing so beautifully. Everybody is doing so well, And I think with age that wisdom is has come that we know कि हाँ सब कुछ अच्छा हो जाएगा.
हो
And
जाएगा.
I love the Finish Line School of
Just
Dentistry.
give me 1 minute.
I told you
Yeah, that's fine.
in
Okay.
the beginning that
Thank you,
I love
Surya.
the
He's a
name and I
great
love.
bro. All the very best. So your wishes coming on from a fellow surgeon himself.
Yeah, I thanks Surya. Thanks,
All
like
right.
respect. Thank you so much.
I think I have lost out the audio. I'm not able to hear this thing anymore. In any case, just 1 minute.
Yeah, you're quite audible, very clear.
No, I think it's come back to my headphones. I don't know what's happening. Something
Bluetooth connect हो गया होगा.
Bluetooth connect हो जाता है यार all this. So all right, I think let's call it a night. All right.
Yeah,
Well, let's
absolutely.
let's call it a
I
day.
should
I'm
pack up.
sorry. Let's not call it a night. Let's call it a day.
Let's call it.
Let's call it a day. All right. So
Yeah. All right.
thank you, Minamam, for joining in. Uh, so everybody, thank you. I would like to thank all the guests for joining in today. We had a brilliant and wonderful and highly informative session with Dr. Prabuddh Sen, and I promise to bring more such sessions on a regular basis and also bring back, Prabhu, like whenever we have panel discuss, I would like to bring all of you back, everybody who's ever come on the Finish Line
Yeah,
School.
absolutely.
And
I would love to share whatever I know.
absolutely, absolutely. And now one thing that I've always insisted, guests, all guests are welcome to participate through the video camera. Don't be shy at all. Just come in and talk to us. If you have any medical health or dental health problems, please come and talk to us. Like there's no kind of stoppage. So this is almost an open season. That's how I put it forward. All right. Thank you all for joining in and have a good night's sleep.
Yeah.
Thank you, Prabodh, for
Thanks, Manoj.
sparing your time
Thank you
and
for
thank you
having
for
me.
showing a wonderful setup all
Hey,
round.
hey, thank you for having me. I really appreciate it. It was a lot of
Thank
fun
you.
for me as well. Thank you. Thanks.
Absolutely.
Bye, everybody.
All right.
Bye, bye.
Bye and good night.
Bye. Good night.
Yes. Good night. So that was a Smile Surgeon.
The Finish Line School's practice management series, and I will bring you more and more sessions, more lectures in the coming weeks. And now I've decided to activate it a bit more. So, coming to all of you from my house here in Chandigarh, and hoping to meet you all live and all in person at some point of life. May our roads meet. Thank you all for joining in, and looking forward to seeing you again for another fabulous session. All right, that's where I leave you. Bye bye.